So let's go back to that slide again. The second type of healthcare system that Mr. Reed talks about is the beverage system, which was invented in Great Britain. It's used in the United Kingdom, Italy, Spain, most of Scandinavia. Actually, Hong Kong had it before China absorbed Hong Kong. And the citizens insisted that they keep the system because it worked so well. And Cuba's health insurance system or healthcare system would be called the beverage system. That system is sort of the other end of the spectrum, where it's mostly government-employed providers. So the doctors work for the government. The hospitals are owned by the government. And the payer is also the government. So people pay taxes to the government. Those taxes are used to pay for health insurance for everyone. And there's 100% coverage. So that system would most likely be called socialized medicine, probably. The next one I'm going to talk about is national health insurance. That's Canada. You hear a lot of people compare Canadian healthcare to the United States and the pros and cons of the two different kinds of systems. It's also been adopted in Taiwan and South Korea and a few other countries. That's different from the beverage system in that the doctors and hospitals are private, so they charge whatever they want to charge, and the government is the payer, though. So people pay in taxes to the government, and then the private doctors and insurance companies bill the government for their services, and the government pays them. It's highly regulated. The fourth system I'll mention is what he terms out-of-pocket, which is basically countries who do not have much health insurance in general. They have a huge percentage of their populations who don't have health insurance, and they simply have to pay the doctor if they go to see the doctor out of pocket. And countries he classifies in that category are Cambodia, India, much of China, Egypt, and of course many of the developing world would be classified as out-of-pocket health insurance systems. So I'd like to talk about the Bismarck system some more. Actually, before we do that, let's talk about what would we classify the U.S. healthcare system. And it's really kind of a hodgepodge. Many working people have health insurance systems similar to the Bismarck system, sort of like what Germany and France has, but with some big differences. We have for-profit insurance companies, and it's not nearly as regulated as the Bismarck system is. All right. Military personnel and veterans have a system that is basically identical to the beverage system, what's in the United Kingdom. Doctors are government employees. Hospitals are run by the government. So, you know, I have a friend who's a veteran who goes to the VA hospital and gets treated. For people who are over 65 in the United States, obviously they have Medicare. That would be termed national health insurance. They can go to a private doctor, but the government pays the private doctor. The private doctor bills the government for the treatment of the Medicare person. And then, of course, for the 47 million uninsured people in the United States, that's out of pocket. If they get sick and they have to go see a doctor or go to the hospital, they owe the money that they have to pay. All right, let's look at the Bismarck model some more. Let's talk about the characteristics of the Bismarck model. And remember, this is in Germany and France. Everyone has coverage. It's private providers. It's also private insurance companies, but they are required by law to be nonprofit. Employer and employees pay premiums for people who are working. The government pays the premiums for the unemployed. And the next one is very important. I've underlined the things that I think are particularly important. I apologize for the underline kind of shimmering on your screen. I didn't expect that. Cost and coverage is transparent and highly regulated. So there's an electronic database that doctors and healthcare providers refer to find out how much they can bill for different things. And everyone has access to this. I've had to spend several hours on the phone recently with my personal private health insurance company because I had a blood test as part of an annual physical, and they were charging me a copay for it, which didn't make any sense to me. And I called my insurance. You've all been through this. You call your insurance company, you go through this menu of people, you talk to somebody, they tell you one thing, which is what happened to me, and they said they would pay for it. And then a month later, I got another bill, and I called them back, and I had to work my way through the ladder again, and I spent literally hours on the phone. It wasn't a huge amount of money, but it was very frustrating. And no one could tell me whether it was covered on my insurance policy or not. They said I had to talk to my employer. I talked to my employer. They couldn't tell me. They told me the insurance company had to tell me. It went back and forth. It was very frustrating. In the Bismarck model, everything is transparent. You know exactly what your coverage is. Every doctor, every healthcare provider, every citizen can look up what the coverage is, what it's going to cost, all that kind of thing. So it's much more regulated than what we have in the United States. It is a multi-payer system. There's over 200 private insurance companies in Germany, for example. But it functions like single payer. Doctors spend less than a third as much on overhead in their offices for employees. Every doctor bills every visit themselves. They just hit a button on their computer and the bill gets sent out, and by law they're paid within 3 days. It's very efficient and hence a very low overhead. Part of that is that every person has an encrypted personal health care record card. So you bring a plastic card to the doctor or the hospital or whatever. They slide it through a reader, and the doctor can look at your health care record. That makes a lot of sense to me. It saves a lot of overhead in information transfer and record keeping. And you own your own health care record. It's all in your card. They talk about how if you lose your card and somebody finds it, if you just put it in the post box, it automatically it's mailed back to you. So that's a very efficient system. They have very low malpractice insurance premiums. That kind of makes sense. Doctors make significantly lower incomes. And doctors complain about that, some of them bitterly, in France and Germany. They say, I would make 3 times as much money if I was in the United States. So you can argue that that's a downside, perhaps. But the upside is, in both of those countries, doctors go to medical school for free. So they may make a lot less money once they become a doctor, but they don't build up this huge amount of debt that many doctors do when they go to medical school. And they graduate from medical school owing several $100,000. So they don't have the debt when they graduate, but they make significantly less money. In terms of choice, patients may go to any doctor or hospital. So the Bismarck model really intrigued me because it keeps costs down. It has, as we will see, high quality. It has a high choice, and it's very efficient. And it's the closest model that exists out there to what we have in the United States.